So Global Health Advocates is publishing a brief series, so on Monday, on March 18th, which will be looking into these initiatives and to see how they are contributing to health equity. If we could just move to the second slide, please. Thank you. In terms of agenda to guide today's discussion, I will be handing over in a few moments to my colleague, Tarita Baldan, who is an EU Advocacy and Policy Officer here at GHA, and she will be presenting the main findings of our analysis, so contained in 3 briefs. This is going to be followed by a short discussion with our panelists, who I will introduce a little bit later, who come from both African and European civil society organizations. And during this panel discussion, we will discuss the findings, so of this analysis on the challenges and opportunities of supporting Africa's health objectives through Team Europe approach. And if time allows, we will also have a short Q&A at the end, and then some closing remarks. So yeah, thanks again to everyone for being here today. I will now hand over to my colleague, Tarita.
Thank you, Rowan, and good afternoon, everyone. Thank you for joining us. So today I will be presenting you GHA's brief series, Navigating the Team Europe Approach in the EU-AU Health Partnership. Our series is composed of 3 briefs. The first focuses on health commitments announced during the EU-AU Summit, with a focus on the 5 regional Team Europe initiatives. The second looks how Team Europe is engaging with African partners and how it could best support African health sovereignty and equity. And the third and final brief explores the challenges and opportunities of working in a Team Europe approach to deliver health for all, as well as the transparency and accountability issues that emerge with it. We do recognize that it's still a bit early to fully capture the impact of these different initiatives, but we found it was important to keep a closer look at how they're being designed and operationalized to ensure that effective development cooperation principles are being respected. Our analysis is based on EU official documents, literature review, information gathered during relevant events, and informal exchanges with relevant stakeholders. So let's get started with a quick look at the Team Europe, the Global Gateway, and the EU-AU commitments. So the Team Europe approach was born out of the context of the EU's COVID response to support partner countries to address the consequences of the pandemic. The rationale of the approach is to pull together resources and expertise from EU, its member states, and development financial institutions to have transformational impact. Team Europe created a new political momentum, highlighting the importance for the EU, its member states, to work better together through enhanced cooperation and complementarity. The Team Europe initiatives, in short, the TEIs, are the translation of this approach into practice. The Team Europe approach is also the main implementing path of the Global Gateway strategy, which is the EU strategy to help tackle the most pressing global challenges. And a Global Gateway investment package of at least 150 billion euros was announced to support the common EU-AU ambition for 2030 as a deliverable of the 6th EU-AU summit that took place in February 2022. This package was broken down into several thematic packages, including one for health, with both short-term and long-term actions. Indeed, health was identified as a high joint priority, and leaders committed to support a full-fledged African health sovereignty. But if we compare the total investment package of 150 billion euro, the initial amount allocated to health was less than 2%, which we find very low, particularly consider that this announcement was made during the pandemic. The package also is quite vague when it comes to specifying how much money would be coming from the EU budget and how much other Team Europe members would contribute, making the tracking and accountability very challenging. The majority of these commitments will be delivered through 5 regional Team Europe initiatives, including the manufacturing and access to vaccines, manufacturing health technologies, the MAF+, the sexual reproductive health and rights, the SRHR, a One Health, a digital health, and a public health institutes PHI Team Europe initiative. So this table you can see now provides an overview of these 5 TEIs. It's important to note that 3 out of the 5 initiatives have not yet been officially launched, and there's not a lot of information available about them. As you can see in the table, the members of the different TEIs vary depending on the initiative, and the membership is voluntary, dynamic, and ever evolving. But it's still unclear today what are the implications for Team Europe members in terms of budgetary contributions outside the EU budget. The MAF+ was the first of these initiatives to be launched back in May 2021. It was partially a response to the inequity in the distribution of medical countermeasures that we saw during the COVID pandemic. It's worth noting that when the MAF+ was first announced, there was a bit of confusion among African partners who had initially understood it consisted of new and fresh funds, when in reality, most of the contributions consisted of already existing projects or funds that had been pledged but not yet officially disbursed. So this misunderstanding is an indication of the lack of African partners' involvement in the initiatives designed. The MAF+ has 3 key dimensions, the supply side, the demand side, and an enabling environment. And it revolves around 6 different work streams. Today, it has an indicative combined financial contribution of 1.3 billion euros. And some progress has been made in terms of implementation of the MAF+ with support from Team Europe to both regional projects, including the Partnership for African Vaccine Manufacturing, the WHO mRNA Technology Transfer Hub, the African Vaccine Agency, as well as targeted to support to 6 partner countries, including Senegal, Rwanda, Ghana, South Africa, Nigeria, and Egypt. The SRHR initiative was launched in December 2022, and it aims to advance the SRHR agenda. There are over 170 projects contributing to this initiative, with a total indicative contribution amounting to almost 1.8 billion euros. The Commission does recognize that most of the contributing projects were already ongoing when this initiative was created, while a selective few have been created afterwards. But unfortunately, there's no public available mapping of the projects that contributed to this initiative, which makes it difficult to really know how concretely this initiative is being implemented. So after this first overview of the TEIs, let's look at the brief 2 at African health priorities, the engagement of Team Europe with African stakeholders, and how it could best support African health sovereignty and equity. It's worth noting that a strong focus on internal Team Europe alignment could risk sidelining the alignment with African countries if they're not properly and sufficiently incorporated into the design and various phases of these initiatives. The refusal of African Union to accept the EU-Africa investment package as an annex to the EU-AU Summit's political declaration reflects some tensions surrounding the negotiations. These tensions could be explained by the lack of consultation and dialogue with the continent around these investments. And even though partner countries were not included in the design of the health TEIs, in principle, their objectives are in line with the continent's health priority, particularly the Africa's new public health order. In fact, Africa CDC officials share that there is willingness from Team Europe to align with their priorities. But yet, African CDC's officials also highlighted there are a few areas where African partners would like to see increased support from Team Europe. And these include research and innovation, technology transfer, talent development, and climate change. And when it comes to the inclusion of civil society, EU officials recognize that CSOs were not closely involved or included in the TI consultations. Some critics of the Global Gateway strategy note that its attempt to serve both the EU foreign policy and development cooperation interest can be a bit problematic for several reasons, including the lack of new resources, prioritization of private sector interest, and focus on geopolitical competition instead of partner countries' needs. So it's central to ensure that EU's external action strategies create a true partnership of equals, and there is actual co-ownership and inclusion of partners in the design and implementation of actions. And while the EU is promoting the MAF Plus as a human development initiative, this can be questioned, especially if we consider that significant amount of investments is going towards the development of pharmaceutical industry and its supply chain. The realization of the right to health must be put ahead of the profits of the pharma industry. And for that, it's crucial that the EU puts in place access conditions to ensure that products are available, affordable, and accessible to those who need them the most when providing public funding to incentivize pharmaceutical production and biomedical research. The current setup of grants and concessional loans investments could lead to the proliferation of satellite production sites of large European companies in the continent. This is concerning, considering there are some doubts about whether they could truly contribute to Africa's health sovereignty and equity in the long term. It's important also to keep in mind that the MAV Plus initiative is one of the flagship projects of the Global Gateway, and this strategy has an explicit objective of creating opportunities for EU member states' private sector to invest and remain competitive. The German company BioNTech, for instance, is establishing manufacturing capacities for mRNA vaccine in Africa by producing biocontainers, mainly shipping containers that are transformed into manufacturing units that are produced in Europe and then shipped to Africa. Although BioNTech is investing $150 million into a facility in Rwanda, which has not received funds from the EU, President von der Leyen proudly promotes this facility as being linked to the Global Gateway, even though the Commission has never explicitly clarified whether BioNTech's private investments are a contribution to the 150 billion euro Global Gateway package. Another risk that emerges with this type of approach is vaccine nationalism. When the next pandemic emerges, how can we ensure that satellite production sites produce vaccines tailored to the needs of the local population if they're not locally owned? And it's understandable that in the first years of implementation, the MAV Plus focused mainly on vaccine manufacturing, but this initiative should go beyond vaccines and support a broad collection of medical countermeasures, including diagnostics, treatments, and therapeutics. And although having the right tools available to address basic health needs is fundamental, in order to ensure healthy lives and promote well-being for all by 2030, investments in these regional TEIs need to be accompanied by investments in service delivery and competent health workforce. And for that, the EU and its memberships should continue on the one hand to provide regional support through the health TEIs, and on the other hand, ensure that bilateral health programs and global health initiatives receive adequate support to strengthen health systems at both national and local level. Finally, in our third brief, we look into the different levels of coordination required from Team Europe as well as the challenges and opportunities that emerge with them. And while coordination should be one of the main strengths of the Team Europe approach, it also happens to be one of the main operational challenges. While everyone agrees on the need and added value of joining forces, there are several practical difficulties in doing so. For instance, there are coordination issues among Team Europe members, be it diplomatic struggles, administrative hurdles, or even competition. Team Europe also seeks to make itself more visible to the world with this approach, since they feel that the EU does not get enough visibility and political return, giving its economic and financial weight in Africa. But a few years after this approach was created, it still lacks visibility and recognition among African partners and citizens. Also, the desire to make the team more visible comes in direct contrast with some member states' desire to still make their individual actions recognized. Another great challenge is to ensure that the different health TEIs and other health programs funded by Team Europe are coherent and complementary. In fact, the Commission recognizes that these initiatives could benefit from a more structured approach and cooperation. I think there is a fine line between complementarity and overlap. Synergies and complementarities can also be found between TEIs and existing global health initiatives, such as Global Fund and Gavi, who are also committed to supporting local manufacturing agenda. Gavi will also launch a new innovative financing instrument, the African Vaccine Manufacturing Accelerator, and the Global Fund is also supporting African governments to purchase drugs produced regionally. The EU also acknowledges the need to have an integrated health in all policies approach to achieve global health objectives. But in practice, it's harder to accomplish, and sometimes EU's approach between different policy areas can be incoherent. For instance, in reviewing the EU pharmaceutical legislation, the current proposal omits any mention to global health. And while the Team Europe could certainly make its international partnership more effective and efficient by pooling resources, a joint approach that leads to Team Europe commitments also leads to difficulties in holding individual members, in particular the EU, accountable. This is the case for the financial tracking and reporting of these initiatives. As mentioned before, it's still unclear to what extent the contribution to these initiatives consists of fresh resources and where these fundings are actually coming from. In order to monitor, report on, and evaluate the TEIs, the EU has created the TEI More framework. It's designed to be a flexible and light to maximize the use of Team Europe members' existing monitoring system, and it's a non-mandatory tool. A concern that emerges with the TEI approach is the risk of double counting, because as synergies increase, so does the risk of an action contributing to different objectives and initiatives, which could lead to double reporting. The ongoing midterm evaluation of the EU's Development Cooperation Instrument, the NDICI, should provide some insights on the initial impact of the TEIs, as well as some key lessons learned, which we hope will be integrated into the ongoing review of the EU's development programs. To conclude, this analysis helps led us to identify 4 key elements to ensure the success of TEIs. And for that, Team Europe must first ensure that its health priorities are in line with those of African partners. Second, be able to allocate sufficient resources to deliver on its commitments in a coordinated and effective way. Third, communicate and share timely information about these initiatives and their impact to demonstrate the added value of the approach. And finally, be able to keep health high in its agenda with equity at its core. Thank you for listening, and over to you, Rowan.
Thanks a lot, Tarita, for this very comprehensive overview of the research and analysis so that has been carried out. In just a moment, I will be turning to our speakers for the panel discussion, but just a quick note to say that participants are very welcome and encouraged to share their thoughts on social media using the hashtag EU for health, which I am just going to drop in the chat. So feel free to share your thoughts, be it on Twitter or X, I should say, LinkedIn, etc. If we can now move to the panel discussion. So we are very pleased today to be joined by three experts, three speakers. Thanks again for being with us here today. If I could just ask you to please turn your cameras on. That would be fantastic. And fantastic. So today we are joined firstly by Fitsum Lakew Alemayehu. I hope I'm pronouncing your name okay, who is the AU Liaison Manager and African Civil Society Platform for Health Coordinator from WACI Health, who advises CSOs on engagement in EU partnerships. Secondly, we are joined by Antonio Perrelli, who is a global health advocate at WEMOS and member of the Access to Medicines team. And last, but certainly not least, we are joined by Dr. Farwa Sial, who is a Senior Policy and Advocacy Officer at Eurodad, and who is specialized in development finance. Thanks again very much for being here with us today. I'm going to start with maybe quite a basic question. We were wondering what your initial reactions or reflections are to the findings that my colleague Tarita presented a few minutes ago. Maybe I can start with you, Fitsum.
Thank you very much, Rowan, and thank you also for the wonderful presentation that was made. I went through the brief and I
think we have a sound issue. We can't seem to hear you, Fitsum.
Hello? No?
We can, Rowan.
Ah.
Is it better now? No?
Yes, we can hear you, Fitsum. Please go ahead.
Thank you. So I would like to start by congratulating GHA for the wonderful briefs that you have done, and the methodology and approach that you have also used clearly also give the picture of the AU-EU summit, and also trying to understand what the different packages of that partnership or summit was. So looking into the three briefs, how Team Europe delivered on its health commitments, brief 2 on how Team Europe is engaging with Africa partners in supporting health equity, and also the third one on how Team Europe is working together for better health outcomes. So this is a very good document, one that will also give African civil societies on the comprehensive package deal that went through during the AU-EU summit, which we can also easily use for our advocacy and also to build our key messagings around it. Usually these things happen at a bilateral level, and there is little, especially for civil societies, to have these data and also commitments on their tables. So kudos, well done, JHA, and a wonderful read as well.
Thank you very much, Fitsum. It's true. It was quite a bit of research, not always very easy, as my colleague Tarita mentioned. Gathering information about these TIs was not always very simple, but yeah, we believe it to be quite an important exercise. If I can move to you now, Antonio, if you could just share us maybe your reactions.
Yes, thank you very much. Can you hear me loud and clear?
Yes, thank you.
Okay, yeah, thanks. No, indeed, good morning, good afternoon, good evening, everyone, depending on your time zone. And I would start by saying thanks to Global Health, global health advocates, for inviting me to this event. As for the findings, I think you have issued a very informative piece of work, echoing on what Fitsum already said. I think that indeed bringing together all aspects involved in Team Europe approach and AU-EU partnerships, especially in the field of health, was needed. And I think it's really helpful considering the complexity of the structure of Team Europe investments. And it's sometimes really hard to get all the pieces together. So thanks for putting this together. And I really appreciate, especially appreciate the analysis on the contrast that you have one point of the briefs that you mentioned during the presentation as well, on the contrast between global gateway and goal of creating opportunities for the European private sector on one hand to invest in Africa, and the human development and public health aspirations of MAF+. So I think both initiatives present, of course, commercial and public health elements, but can these two elements coexist? For now, I think it's really hard to understand whether this dichotomy will result in a fair balance between the aspirations of the European private sector and the much needed boost to local manufacturing capacities in the African continent. Yeah, and as you suggest in your work, I think it's essential that we look at the initiatives that also have thrived under MAF+ to better understand the direction the overall Team Europe initiative has taken in general. So I would stop right here for now, and thank you very much.
Fantastic, thank you. Thank you very much, Antonio. If I can move to you now, Farwa, with the same question.
Yeah, thank you. First of all, thanks a lot for the opportunity to be here and also read the report, which is very, very timely and clear in investigating the progress made by Team Europe so far. So actually, I join Fitsum and Antonio in congratulating the team, and I am also aware of how hard it is to actually look at how these projects are developing. I mean, this is a problem that we often have when looking at certain developments at the European developmental level. And also, I mean, it's important to say that without this kind of independent research, there is no way of knowing how and which projects, which are often, celebrated as doing very well, are actually doing how they're doing on the ground. So I think the three things which really stood out for me in this report were, some of the bare facts that we need to remember. First of all, that it's been 2 years since the AU-EU summit, and only 3 out of 5 projects have been launched. I mean, that says something about maybe the challenges, but also the political will behind these projects. Second, that less than 2% of the 150 billion euros allocated under the Global Gateway go to health. And of course, we are in a context of post-pandemic, so that's a very important limitation of the project. And then finally, questioning the very meaning of partnership, which was a very, very big sort of narrative in the entire report, looking at all the different projects. And of course, this comes at the point when there are heightened tensions between Europe and Africa. So we can think about the Cotonou Treaty, we can think about ECOWAS, and more broadly, some of the comments which are often made by EU officials in Europe, but also when they visit Africa. So there is all of this happening, and then there is the question of health as a public good, and I think the report makes very important contributions in challenging the entire scope of what it means to provide public health, health as a public good. Thank you. I'll stop here.
Thanks a lot to the three of you for this first round of reactions and reflections. If I can now come back to you, Fitsum, for a moment. I mean, African leaders have been calling for a proper action-oriented partnership based on mutual respect for, I think, quite a while now. How would you describe the direction the EU-AU partnership has taken in recent years? And in your opinion, what do you think could be improved in the EU's approach to allow it to adequately support its African partners in achieving better health?
Thank you very much. That's a very tricky question, to be honest. However, I share the sentiments of African leaders in terms of the partnership that you have mentioned. I mean, quite time and time again, we have witnessed that there are a few red lines that have been set by European Union and also some European Union countries, which have been very much been a challenge for African leaders to negotiate upon. For example, the basic one would be looking into the knowledge transfer, IP transfer, like patent rights and those things. So there have been some problems here and there whereby African countries, especially looking at the pandemic response, there was a problem for Africans even to kind of utilize what we have as a manufacturing capacity to develop those vaccines and medical countermeasures on the continent. And that has been a red line for some European countries and at large for EU to address those questions. And within the context of partnership and global solidarity, I believe that's something we need to reconsider. And even if there needs to be a red line drawn by African countries, I believe that's something also AU should look back and also consider, where we need to have those red lines in terms of sharing information for those very vaccines that have been developed so far, and also other medical countermeasures. I believe the other thing also we need to look into is the active participation of communities and civil societies in these conversations and partnerships. Time and time again, we are witnessing that these partnerships are usually done at a bilateral level. For example, we have 55 member states in Africa, we have 27 member states in EU, if I'm correct. And also for EU, we see a more organized and structured approach and partnership. However, coming to the African continent, we see sometimes a bit of here and there engagements which are not really directed in one channel. For example, looking into the negotiations of the intergovernmental negotiation, looking into the negotiations that happened last year on the high-level meetings, we have seen that there is another group called the African Group, which was leading negotiations on behalf of the continent, whereas we have a political institution called the African Union, who has been leading most of the political and the policy dialogues on the continent. So even looking back, for us, it will be very important to advocate for one structure to really use that to negotiate and do partnerships with EU. For EU, I believe EU, given the experience of working with civil societies and also WACI Health being one of the organizations leading a civil society engagement mechanism with AU and EU, I believe EU should push for civil societies and communities to be part in the room, whereby informed advocacies will take place. What are these partnerships about? What amount of resources are we allocating? In what time frame? So all these details need to be very much cleared out moving forward for effective advocacy. So let me stop here. Maybe I will further beef it up with questions.
Sure, thanks a lot, Fitsum. Maybe just a very quick follow-up question, but I think you partly touched upon, some of the elements of the answer already. Do you think that there's a feeling among African stakeholders that there has been a genuine change towards a more equal partnership with the EU and its member states?
I don't think so. I don't think so. And with our experience of working with African Union and also Africa CDC, and also some statements, especially with regards to some political declarations that were passed last year, and also looking into some of the processes like the FGHI, the AMR conversations this year, it seems to be even getting more stronger. And there is this feeling again from African Union and other intergovernmental institutions within the continent that actually it's getting stronger than being loose and more addressing multilateral principles and respecting global solidarity.
Thank you. Thank you for this, Fitsum. If I can now move back over to you, Antonio. I believe WEMOS is currently conducting a case study analysis on manufacturing capacities in Rwanda. And we're wondering, are there any additional insights or reflections from your own upcoming case studies that you would maybe like to share? So, for example, on Team Europe's support to the regional manufacturing agenda, and also on how to best achieve African health sovereignty.
Thank you very much, Rowan. Yeah, I think indeed there is a strong link between Team Europe's support to regional manufacturing agenda and what is concretely happening in Rwanda. I think that the rollout of BioNTech mRNA facility represents a great test case for MAV+, and for vaccine manufacturing in general. I think it will tell us more about the balance between the facilitation that we already mentioned of private sector investments and public health needs, which are the most important, but not always taken into account as much as investments from the private sector. Considering this link between BioNTech mRNA facility in Rwanda and the resources that have been mobilized locally, also through MAF+, we have decided at WEMOS to conduct a case study together with partner organizations for both Rwanda and Uganda. Indeed, to give you a little bit of context, with the Great Lakes Initiative for Health Development Initiative and Afianaki, to explore to what extent the BioNTech manufacturing initiative in Rwanda will contribute to health equity, sovereignty, and self-reliance in relation to access to medicines. Many interesting elements emerged from the analysis, and I'm happy to share some considerations, findings, and provisional recommendations for now from our imminent report. In general, what I can start with is that I think it's really hard, as you have also said, to completely measure and understand the impact that MAF+ will have in the long term on local, regional, and continental manufacturing capacity. But if the only initiatives thriving under MAF+ are satellite production sites from North-based biotechnology and pharma companies, then the impact will mostly be limited to the short term. These are not structural kind of solution unless we don't transform them into something else. And to expand the impact of MAF+ and of these initiatives and address local public health needs in the long term, we will need a meaningful transfer of technology, know-how, including trade secrets towards locally owned companies. Only this way, the scientific community and the public and private sector from the African continent will increase local manufacturing capacities in the long term. And only this way, African countries will take ownership of production facilities. So let's remember that MAF+ presents the transfer of technology as one of the 6 main areas, work streams, or of the initiative at the continental level. We now need to understand how this translates into practice at the country level. And as for MAF+ funds and their impact on BioNTech mRNA facility in Rwanda, as we have already mentioned, the facility has been integrally financed by the German company. And this is something you also mentioned in your brief, but the enabling environment, once again, has been massively sustained by funds from Team Europe Initiative. It emerged that BioNTech, from our research as well, as other private actors, of course, indirectly benefits from such financial support and a favorable enabling environment. For example, a consortium of European development agencies is sustaining the Rwandan Food and Drug Authority for the attainment of maturity level 3, which is a global benchmarking tool for the WHO that allows, among other things, to export produced goods and, more in general, decide on market access for vaccines. And strengthening regulatory capacities will, of course, facilitate BioNTech's operations in the future. As investments are therefore facilitated, Global Gateway objective that you mentioned as well in your brief of creating opportunities for the European private sector to invest in Africa takes form. On the other hand, MAF+ aspirations on human development and public health must follow. So in light of this favorable environment deriving from MAF+ investments, we believe that conditions should be attached to funds stemming from Team Europe Initiative, especially for intellectual property and the transfer of technology, knowledge, and know-how, because this would allow eventually Rwanda, East Africa, and the overall African continent not only to be able to respond to pandemic threats today, but also to build an end-to-end value chain for African vaccine manufacturing in the future, prioritizing local epidemiological needs and allowing African countries to autonomously decide on the pricing and allocation of doses. So Team Europe should therefore set conditions to ensure that not only private investors, but also recipient countries can benefit from MAF+. And let's remember that over 100 manufacturers in low and middle income countries are considered suitable for the production of mRNA vaccines, and 8 of these potential manufacturers are located in the African continent. So in conclusion, without access to intellectual property, technology, and know-how, satellite production sites can produce on the African continent, but the ownership of such initiative will stay in the global north. However, our case study will be finalized and published in April. So I would advise you to follow WEMOS updates on social media if you want to know more about our work on regional manufacturing and read our report on the biotech mRNA facility in Rwanda. And thank you very much for your attention. I will stop here for now and happy to answer any question if you have any. And over to you again, Rowan. Thanks.
Thank you so much, Antonio. Very much look forward to reading WEMOS's report as well. I think you've made some very interesting points. Now if I can come back to you, Farwa. So you are also in the process of conducting an analysis, this time to understand what a vaccine manufacturing facility under the EU's Global Gateway means for recipient countries. Can you tell us a little bit more about this? Do you have any initial reflections on this to share with us today? And maybe you have some concerns regarding the Global Gateway as well?
Yeah, hi. This is the second report that we're working on the Global Gateway with the partner organization Counterbalance. And the first report was a broad overview of what the Global Gateway is, what are the ambitions, what does it mean to be an investment-oriented model under the EU. And the second report is a broader look at how the projects have been rolled out, what kind of projects are in operation, and what are they trying to achieve. So we're looking at a range of projects from energy to critical raw materials to health and infrastructure broadly, because this is what the Team Europe and Global Gateway offer is, and it should be out in May. With regards to our findings on health, I think we as you know, it's really difficult to get more information on these projects independently, and this is why we were in touch with you and with WEMOS, looking at what these projects actually mean. And yeah, I mean, some of the things that already has been mentioned by Antonio, as well as flagged by Fitsum, are really concerning. So first of all, once again, we go back to the context of a pandemic, failure of a people's vaccine, then this attempt to have a facility which was a public-private kind of partnership on a multilateral level, the COVAX, and we know that it failed to meet the target of coverage. So that did not happen. At the same time, the very, very pressing issue in all of this was the failure to provide access to IP. You have to free IP for countries to then manufacture and control any kind of pandemic. And we have to seek every effort in and have to judge every effort in how it will do so in the future. So if you, once again, place Team Europe's health initiative, as your report really shows very well, that, you know, we have this interlinked theme of manufacturing, of industrial policy, and then of course health is a public good. But and combined with it is this idea of knowledge transfer. So first of all, the knowledge transfer is happening without IP rights. The manufacturing, I mean, it's alarming to think that these are shipping containers going from the EU to Africa. You know, this is not your industrial policy. This is not equipping any kind of manufacturing capacity. We see no linkages with policy, with health, with other sectors, for example. So I think that's not quite right to say that it is a manufacturing industrial policy-led strategy to support health. And finally, as Antonio already mentioned, I mean, we saw how much pharmaceutical companies benefited from the pandemic. I mean, the profits soared. And once again, we have a private company which is providing investment. And for some strange reason, we see that it is being claimed as part of a developmental oriented effort, the Global Gateway, whereas that's actually not the case. So, you know, what kind of a model are we talking about here, which is monopoly capital, not exactly knowledge transfer, not really manufacturing or productive capacity in recipient countries, and then again, this problematic notion of partnerships. So I'll stop here for now. And yes, our report will be out in May, and we hope to get a lot of feedback from everyone here. Thank you.
Thank you so much, Farwa. And if I may say, I'm very impressed by the timekeeping of our three speakers. We are right on the dot, so thank you very much. We would now like to open the floor to participants to react and ask questions. I see we have a couple in the chat already. So yeah, once again, please do feel free to type your questions in the chat, so to the right of the screen, and please ensure to specify who your question is addressed to. We have some questions already that have come in. I think this is probably one for you, Antonio. And I think we've touched upon this already quite extensively. But if you had to summarize, what are the conditions which are required to ensure a reinforced EU-Africa RNI partnership to become sustainable in the long term? What would you say to summarize it?
Is it directed to me, the question?
You can take it, or if someone else wants to take it, that's fine.
No, I would be happy to. No, I just didn't get if it was me that you mentioned.
Sure, please
Okay.
go ahead, Antonio.
Okay. No, I think that we need to keep in mind the necessary conditions for this to happen on the long term, because as we have seen with satellite production sites as an example in mind, as all these initiatives which might come from BioNTech or Moderna, especially from these biotechnology companies, I think what we should keep in mind is that health equity might be reached because, of course, we might be able to provide production in Africa. But then are we providing it for the African continent? Maybe, but is provided by the African continent? That the answer will be no, because if the profits stay in Europe, then in the first place, it won't be there won't be ownership in terms in commercial terms. And in general, I think that the concept of sovereignty, self-reliance are always popping up all over the place, and we use them a lot. But we need to keep in mind what this means. And so when we talk about sovereignty, we should also mention, of course, what sovereignty means. And for us, it also means that autonomous determination must be put at the backbone of this initiative, of priorities in research and development, or decision on pricing, on allocation of doses. And this is the first thing. And then, of course, it's not just about sovereignty, but also about self-reliance. So we need to have a sufficient supply to meet the medical needs that are from the region. So it must be coherent. For example, we should look at national essential medicines list and understand if we are producing coherently with the needs of with the epidemiological needs from the region, from the country, or from the continent in general, to reduce the disease burden and reduce eventually the dependency on external factors. I will stop right here for now. I hope that I have answered the question.
Thank you very much, Antonio. We have a couple more questions coming in via direct message. We have one for Fitsum, asking how can CSOs, and in particular African CSOs, be better engaged and included in EU initiatives?
That's a very good question. And part of my recommendation is also we will do around that. The first one would be for civil societies to really take and own the space. For example, we do have our European Union consulates in most of our countries, or European Union embassies in most of our countries. So part of our advocacy would be to reach out to those embassies and consular offices to understand the deal, to understand the partnership, and also from there to make sure that whenever this monitoring and evaluations happen, that civil societies should form part of it. The other half of the question is back to the respective countries. So there is Ministry of Health, then there is Ministry of Finance, there is the Parliament, whereby we also kind of direct our advocacy questions to those institutions. So I'm suggesting more of a two-way of advocacy, whereby one, we reach the European Union consulates or European Union countries in our respective countries, and at the same time, we direct the same questions to countries through the Ministry of Finance, Ministry of Health, and also the members of Parliament to identify on the status of these partnerships and also how to move forward within that. The other one would be to have a like-minded European civil societies and to understand and also reach out to those civil society partners and make partnerships whereby the follow-up or the advocacy also can happen from two sides. So European civil societies are on a better advantage compared to African civil societies in terms of getting the information, in terms of the advocacy. So African civil societies also can take advantage of those through partnership with European civil society organizations. The other one is we need to really make an informed call for a recognized civil society engagement mechanism in these procedures. As much as the silo engagements are very much important, we need a structured civil society engagement mechanism which also participates in these convenings, in these partnerships. So from there, it will be also very easy for civil society and communities, one, as GHA did, to understand the details, the data to get them, and at the same time also to make their inputs while these processes are happening. So that would be my suggestion. Thank you.
Thank you. Thank you very much, Fitsum. We have a couple of questions coming into the chat again. I'm not sure who this is directed to, but I can maybe read it, and whoever wants to take it can take it. So we have a question asking, is there any information on the impact within the African political dynamics on some of these Team Europe initiatives? For example, with the focus on Rwanda, South Africa, the mRNA hub, Ethiopia, and Senegal. I'm not sure if anyone would like to take this. If you need to read it again, it's in the chat.
I can go ahead if.
Sure, thank you, Antonio.
I don't know. Otherwise, if Fitsum wants to, maybe I can give a very first overview. In
Sure.
our perspective, we did a little bit of work with our partners from both Rwanda and Uganda, and we try to understand a bit more about the power dynamics between these projects, and it's really hard to understand how these pieces will fall into the wider picture of the projects for the African Union. And I think it's no secret that there has been some sort of friction between these projects, not direct friction, but of course it is two projects that are aiming at the same final aim. So yeah, I think that we will be able to provide more details once our report will also be issued. But in general, my first consideration would be that, of course, these initiatives are aiming at the same space. So I think there is some very complex political dynamic also internally from what our partner organization have also witnessed.
Thank you. Some very interesting thoughts there, and once again, I very much look forward to reading WEMOS's upcoming reports. We have 4 minutes left to time. We have one final question here via direct message for Farwa, which I think is quite an interesting one regarding accountability. In your opinion, how can we work together, so be it, for example, as CSOs, to ensure that the EU and its member states are actually held accountable for the commitments they have made?
Yeah, thanks a lot. And I think one of the things that we keep encountering is, even within Europe, is that a lot of people don't have enough information about what the Global Gateway is. Because as already also evident in your report, one of the big confusions here is that it seems like it's fresh money. It's something new coming in for partners, but actually it's old money, which was development money targeted towards different projects, and it's being rebranded as Global Gateway on one level, but also there is a promise of mobilizing or leveraging finance from the private sector. So I think for European civil society, as well as civil society in Africa, Asia, Latin America, where all these projects are being rolled out, I think the key is, of course, to first understand what's happening. And for that, we need more transparency from the Commission. Because as you say, I mean, it shouldn't be a problem for us to access information. It should be in the public domain. And once we have that information, the implications need to be discussed. And they need to be discussed from a broader political economy perspective, rather than the technical sort of knowledge or ad hoc siloed project, as Fitsum was talking about in our approaches. So everything needs to be linked. And for that to happen, I think one of the biggest obstacles we see is that civil society in the Global South has been suffering from a major funding gap. So there is not enough resources available for them to allocate their time, to mobilize their governments, to mobilize EU or global North governments about what's happening. And that remains a challenge. At the same time, I think what needs to happen is that we have to mobilize in a way where information is easily shared and action is directly taken by citizens. And that's actually already happening. So I think here, a country to watch is Rwanda, because as Antonio was already mentioning, there's a reason why some kind of projects are very successfully implemented, And that, of course, doesn't mean that they're giving you the required gains, but they're implemented very well as opposed to others. But at the same time, there is a lot of concerns coming in. So what we can do at best here is amplify what they're saying and take these concerns, because one of the biggest issues with a lot of global gateway projects would be is how do you hold governments accountable? It's a strategy. It's not a legislative sort of binding set of regulations in place. It's a strategy which is very geopolitical. And I know to counter some of the concerns, we need to be better educated and better informed about what's happening, as well as better connected. I'll stop here.
Sure. Thanks. Thank you very much, Farwa. We are now coming to the end of this webinar. Would like to thank all participants for your interest, for being so active in the chat box, and a huge thank you to our 3 expert speakers for providing such valuable reflections and insights. So as mentioned earlier, our brief series will be published next week on March 18th. So that's on Monday. The briefs will be shared with participants. So if you register to this webinar, you will be receiving them alongside the recording as well, which will be made available. Please do feel free to reshare our posts or create your own with your personal social media accounts or your organizations using the Team EU for Health hashtag, which I posted in the chats. And once again, thank you very much. If you have any questions, comments, or feedbacks, do not hesitate to contact us. You have our names and the contact details on the screen. And we wish you a lovely rest of the day. Thank you very much.
Thank you very much. Thanks.
Thank you very much. Thank you.